Welcome. Welcome to Mending Threads. This is your safe place and your stronghold for whole body wellness. We're a transformation series, mind, body, and spirit. So today what we're going to do is look at what makes the topic of diabetes or mental health or chronic disease important. And we want to look at this topic from both directions and many other directions. We want to look at the cultural component, we want to look at psychological and the biblical perspective of disease and ways to remedy and decrease the symptoms and the prevention of chronic disease within our communities. So today I would like to welcome to Mending Threads Miss Tiara Grissom, who is intern with occupational therapist intern from the University of St. Augustine for Health Sciences. Welcome, Miss Grissom. Good morning. How are you? Good afternoon, rather. How are you doing?
Good morning. I'm doing well. How are you?
Good. I'm so glad you could be with us because today I didn't want to hear from someone who had been in the field for years. I wanted to hear from someone who is forming their perceptions and looking at what is occurring before them, and also to look at what you have studied and look at the people and the things that you have engaged with. We want to look at your engagements as well. So, tell me a little bit about how you decide to get into this profession.
Um, so my love for occupational therapy first came from my grandfather. He suffered from multiple strokes, and so just seeing how occupational therapists and physical therapists, as well as speech language pathologists, helped him during his rehabilitation period, it
Can
just
you
made
hear?
me
I
want to
can't
continue.
hardly hear you, but it could be on my end. But say that again.
Let's see. Is it better now?
A little bit, yes. Mhm. No, I can't hear you. I can't. I cannot hear you now at all.
Can you hear me now?
Yes, I can. Yes, I can.
Okay. Sorry. So to answer your question, the reason that I got into occupational therapy, the original reason started with my grandfather. He had multiple strokes, and I saw his recovery process with occupational therapists, speech therapists, as well as physical therapists. And so I did my own research on the difference between occupational versus physical, and I just fell in love with the role of OT and how we are able to help people and do it in a creative way and just do it in a self-centered, holistic type of way.
Yes. Okay. And so actually, so it was really your grandfather's observing him. So did you observe any of his habits that contributed? So how what did you observe?
Just the sense of wholeness that they gave him. He ended up being paralyzed on his entire right side. He had a left stroke, so it caused him to be paralyzed on his right side, which was his dominant side. And so just seeing how he, although he didn't get regain full functioning on his right side, he did regain some. So it gave him more of a sense of independence again. And so that was my biggest thing, wanting to give people their independence back or modify their independence in any way possible.
Hmm. And so I wanted to. So did he have any other kinds of diseases or other contributing factors to his health? And I don't want to pry, but I was just trying to understand the connection between illnesses and what might
Mhm.
contribute. Hmm.
Yes, I don't know all, but I do know that he had high blood pressure as well as diabetes.
Hmm. Okay, then. Yes, yes. So today, what I'd like to do is to talk a little bit about what diabetes look like. Just to look at some of the things. Can you share with how would an occupational therapist link with diabetes, and what have you seen, and what do you think about that from a preventive, I guess, and treatment? Hmm.
So with diabetes, the role of occupational therapists, we look at diabetes self-management as well as preventive care. So if you're pre-diabetic, we want to try to help you find ways to change your lifestyle habits so that you can prevent getting diabetes. And if you do have diabetes, we look at self-management, because there are a few types. So it's different management strategies for the different types of diabetes depending on which type you have. So we look at self-management, excuse me, making sure that if you are insulin dependent, then making sure that you have a regular schedule, making sure that you are taking your insulin, making sure that you're checking your blood glucose levels and knowing what those numbers mean, so that you're not just taking them just to be taking them and you don't know what that means, as well as trying to change lifestyle habits such as your eating habits. We try to look at ways to how can you incorporate exercise into your daily routine, just different things like that to try to help create new lifestyle habits to prevent
Can you
diabetes
can,
from worsening.
can you share with us any differences between these diabetes?
Yes, ma'am. So the three major groups of diabetes are type 1, type 2, and gestational. So type 1 is kind of considered the insulin dependent one, because you don't produce your own insulin, so you're dependent upon insulin injections. Type 2 is more of the insulin resistance or deficiency. And so this is more so where your body rejects its natural insulin as well. And so, and then gestation often happens in women after giving birth to children.
Yes.
Excuse me. So these are groups that affect the body's metabolism and the ability to produce or utilize insulin properly. And we know that insulin is a hormone that is produced within the pancreas in order to control blood sugar levels and breakdown. So we need the insulin and the glucose because it provides energy for our body and for our cells. So our cells need that glucose and needs that so that we can have energy for our body to function properly.
So I guess it's hard for a person, as you're speaking, who might have cravings for things, but it's hard for a person to have diabetes and then with high blood pressure at the same time. So they would have to do certain kinds of things, it would seem, to mitigate, how to decrease one thing before it affects another thing. So what are your thoughts on anything like that?
That just goes back to lifestyle habits. If you know you have high blood pressure, you know you have diabetes, don't eat those sugary things. And if you do eat them in moderation. Moderation is key because it's easier said than done to just cut sugar out of your diet or cut a lot of high sodium products out of your diet. That's easier said than done. So moderation is key. If you know that you can't completely cut it from your diet, moderate. Let's do it in moderation. You may not want to eat it 3 times a day. Let's cut down to 1 time a day. Instead of using butter, use olive oil to cook and things like that. So just trying to just kind of rearrange things and make things a little bit healthier in your eating. And exercising is very important to manage all of these, any chronic disease. Exercise is always a key.
So are there any better exercises than are there some that would really be helpful to a person to either prevent diabetes or in terms of managing their diabetes, either one? And I'll share this with you because I had some difficulty with my leg. I don't have diabetes, but I did have some issues with my heart at once. So one of the things that I found is that there were some exercises that were more beneficial than others to prevent pain. And also there are other exercises that would mediate, would remedy the pain. So are there things like that for diabetes?
Yes, and it also is person specific because for you, if your leg is hurting you, I could recommend that maybe you walk for 15 to 30 minutes a day. But if your leg is in pain, you won't be able to take that 15 to 30-minute walk a day. So it's person specific. But I walking is, I feel like, the easiest start. You walk to your car, you walk to the kitchen, you walk all the time.
Yes.
So why
Yes.
not go outside, get fresh air, walk around the neighborhood, and get 15 minutes in a day, at 30 if possible. So walking is always a good start to incorporating exercise, because once you start walking and you see how, okay, these daily walks are starting to make me feel better, now I can add in other exercises. I can do some bicep curls while I'm just sitting on the couch. I can do different things throughout the day that don't seem like
Mm-hmm.
exercise, but they actually are exercise.
Mm-hmm. And then, amazing to me, all these years, I found that simple things for your back really helps in terms of exercising. For example, posture. People seldom talk about posture. So I know that in occupational therapy, you must have a lot to do with posture in terms of healing, whether it's with disease management, whether it's comorbid with that and occupational needs. Can you talk a little bit about how you help in terms of posture or with diabetes or disease, or how do you
Um,
help the patient? Mm-hmm.
well, we don't look specifically at like posture with diabetes. Obviously, we promote good posture, sitting upright. We don't want bad posture to lead to other things. And aside from the diseases, we don't want lordosis or kyphosis to end up happening because you are deteriorating those bones and your posture. It'll be harder as you get older. It'll be harder to stand upright because you already have gravity against you. So why would you want to have your own body against the self by slouching? We sitting
Mm-hmm.
upright promotes a better posture as well as better breathing as well. You know, it's harder to breathe when you're hunched over. We want you to sit upright, get that airflow in and
Yes.
out. We need that oxygen in and out of our body. Oxygen in, carbon dioxide out. We need those things. So posture does contribute to just everyday functioning, such as our breathing. Um, it decreases back pain if you have better posture. And it also, as you get older, you know, a lot of times we do see older people who have more of a slouch, and it's because
Yes.
of the posture that they had growing up through the years. So if you practice good posture as you get older, you know, it'll decrease the possibility of you having that slouch later down the line in life.
So the other thing that I wanted to know a little bit, can you tell me something about the field of occupational therapy? Can you just share a little bit about what that entails? And, because when we put the word therapy on it, then people start thinking, oh my God, is something wrong? So can you just talk about occupational therapy and the importance of what it entails and how a person could prevent coming to see you?
Mm-hmm. Well, oftentimes with occupational therapy, people ask, do you help us get jobs? Because they hear the word occupation. So, no, that's not really our role. We can if need be, but that's not our primary role, is to help people get jobs. With occupation, we try to help you with your occupations of life, your activities of daily living. So, for example, if with chronic diseases, if it leads to maybe having to get an amputation, we'll help you relearn how to get dressed, relearn how to function. You may not be able to walk, but mobility is important. So, wheelchair mobility, we teach those things as well. And our main goal is independence. How, if you can be as independent as possible, even if it's modified independence, even if you need maybe a reacher to reach things because you can no longer reach them. But as long as you have that reacher, you can do it yourself. So to us, that's still a form of independence. So our main goal is to teach occupation of life and just work on those rehab skills so that you can get that independence. If something were to happen, or if you break a bone, you have an amputation, and you have to relearn how to live again, we want you to not feel like you have to depend on any other person. We want you to be as independent as possible. And there are things you may not be able to ever do again, but as long as we can do majority of the things that you were able to do prior to maybe the disease or prior to an amputation, prior to a broken limb, we want to try to give you as much independence back as possible within your activities of daily living.
I imagine it would be, it's a little different between, do you have patients or persons, have you experienced anyone that's younger, providing occupational therapy for adolescents or youth? Is it any different between older adults and younger adults? I'm sure some of the needs are, but in terms of how they adapt or how you use it or interventions.
Yes, there is a big difference because with the pediatric population, sometimes We have to go on their level, so it also depends at age. And there is school-based occupational therapists as well. So some occupational therapists go into their schools and they look more on the academic and educational level versus a
Mm-hmm.
rehabilitative level. So it just depends on the setting with those populations. But I
Mm-hmm.
have experience with home health care, pediatric home health care,
Mm-hmm.
and in that setting, it was very different from going to an acute care with adults who are fresh out of surgery versus going into children's homes
Mm-hmm.
and trying to teach them, okay, let's learn how to brush our teeth properly. Because sometimes children have sensory disorders where the filling the toothbrush, it bothers them. So we just have to teach them, like, if we can do 5 seconds this side, 5 seconds that side, 5 seconds this side, just trying to get in as much as we can, dealing with sensory processing disorders, dealing with different things like that that children may have that sometimes adults don't have. So it just depends on the prognosis of the adult versus the child.
So I imagine in your training, um, that diets that they have discussed with you, like with diabetes or in terms of working with the person's body, what have you found that's helpful with diabetes in terms of your intervention? How would you help the person if you were working with them through occupational therapy?
You said as far as dieting?
Yes, like you talked about diabetes, the
Mhm.
glucose, and how that might even affect their bone system or whatever's going. So how do you handle them with their diet? What do you tell them? Because people just not going to cut out. Do you give them something to use in its place, or do you go over a diet plan with them? Do you test their bones or something, or their movement? So how do you gauge what they need to do? More of or less of? Hmm.
So again, it's person specific. But as far as a diet, we look at what are your eating habits? What do you intake? Are you drinking a Coke 4 or 5 times a day, knowing that you have diabetes? So we try to look at your lifestyle habits and
Hmm.
how we can modify those. So I take the approach of, I'm not much of a cold turkey person. I can't just stop just because someone tells me to stop. So
Hmm.
my approach is moderation. So let's not drink 4 Cokes a day. Let's start by just only drinking one, and let's lower that. Once we can get to the point where we can only drink 1 Coke a day,
Hmm.
let's do half a Coke a day, and then maybe we don't have to drink a Coke at all. So I just try to like do things in moderation. It's levels. You can't just expect someone to just stop cold turkey necessarily. And I'm realistic. You have to be realistic. You have to know that
Hmm.
people aren't going to just stop because you say stop. So I look at a realistic approach. Let's cut down on this thing. Let's
Hmm.
modify our cooking. Let's not cook with those seasonings. Let's get the seasonings with no salt already added. Let's get seasonings with less sodium added so that we can just slowly start to modify. Let's not use butter when we cook. Let's use virgin olive oil, things like that. So it's like you can still live your life the way you want to live your life, but just make the modifications necessary to make it healthier.
Oh, this is so good. So before you leave, if you could just give us, in terms of what you said, which one of the things seem to be so important for occupational therapy, or to prevent having to go to an occupational therapist. If you could just give us one or two or three things that you think we could do to look at prevention or self management of anything for our, yes. Mm-hmm.
Just again, it goes back to lifestyle habits. So exercising, don't wait until it's too late. Like, oh, my doctor just told me I have high blood pressure, so now I'm going to exercise. No, let's do those things beforehand. Let's exercise, let's eat properly, and sleep. People don't understand sleep is very, very important. Sleep can affect your body in so many ways that we don't think about. So my 3 things would be exercise, healthier eating habits, and sleep.
Oh, that is so wonderful. Well, thank you. I know that the world is going to be a better place with you. I know you're so focused and you're so caring about your topic and people. And I see you at the different centers, and I'm getting feedback that you're a very caring person when you're doing your outreach. and everything. So thank you for being with us today. I hope you stay on because we're getting ready to bring on our own Pastor Corey Wilson of Christian Faith Missionary Church in Houston. He's a senior pastor there, and he's also a psychologist. And we're going to bring him on to help us talk about culture, um, and look at a psychological way of gaining a perspective on chronic disease and health. So, Pastor Wilson, how are you?
I'm doing great. Good afternoon, Dr. Lewis.
Just fine. We'll just have to say the doctor's in the house today. So I know Dr. Atkins understands you're coming from the other perspective. So what did you think about? What do you think about the topic when we look at behavior, blood pressure, disease? Um, what are your thoughts about that? We want to talk about it today, both biblically and psychologically, in terms of mental health, in terms of all of that. So I know that there's a preventive way of looking at it, or before, and it's also a way to look at it afterward. And
Correct.
so I thought maybe we could talk about that, because one of the things is to come out of this with a way that people could see how all of this fits together and how we are a whole person. So, and how would you like to share your perspectives on this topic?
Well, first, I want to commend Miss Tiara for doing a fantastic job
I
of
do.
helping us understand occupational therapy from physical therapy and some of the different characteristics that go with what she does and what she provides. And I want to thank, just say thank you to her for leaving those three things for people to understand, because that kind of takes all she knows and condenses it into three things that is feasibly possible, excuse me, for us to do.
Mm-hmm.
Watch your sleep habits, eating, and your exercising. All those three things contribute. And why am I saying that? First of all, I want to say the topic is culture, mental health, and chronic disease. And I want to say it in a different way. The culture we live in dictates our mental health. And
Mm-hmm.
because of that culture and how it dictates how we think, how we feel, how we behave, it then equates to chronic disease. So they actually all go hand in foot. And when you come into a person's life that's suffering from an end result like a chronic disease, it's kind of hard to get them to break the pattern on the things that was associated with the chronic disease. Here's my point. The problem with helping people sometimes, you got to put them on a new regimen in life. And when they start this, it could be the first month, first week, what have you. They don't see the results of the chronic disease dissipating. So in their mind, I'm not going to keep doing this. I might as well do what I like and do what I want. But what they don't understand, it took years for them to get to this chronic disease as a result. But they don't want to put in the work. Now let's get to why. First of all, mentally they're damaged. Spiritually, they're tapped. They have no motivation. Their environment that they continue to be in, friends, even, I hate to say this, but even church environments are not always healthy. We can no longer assume because we go into a church that the environment and the people and the pastor is healthy. That's
Mm-hmm.
not the case. That's a different discussion, a longer discussion, but I can say that as a pastor. I
Well,
wish it
actually,
was more.
Pastor
Go
Wilson,
ahead.
I
Uh-huh.
think I think I think you're right on, because many of the church congregation groupings, whether we're having a dinner or whatever, actually have just begun to teach some things. Some of the churches, but many tend to eat all of the foods and celebrate events with all of the foods, even on a weekly basis, or did, that are really haphazard or detrimental to our health. So I do know that one of the things that's important would be for to do what you're saying, to train and make interventions in the churches about changing a habit. But yes, you're most certainly correct.
And think about one major sign. We don't hear it this way, but think about this. When a typical African American goes to the hospital, what's the number one thing most of us say? I hate that
That
hospital.
food. That food.
I mean, I just can't stand it. While I was in there, they brought carrots, didn't have no taste. They brought this, didn't have no that. And all they were thinking while in the hospital, right, was when I'm going to get back to my neck bone, right? Just, I want you to put
Right.
this in
Mhm.
perspective. They're in the hospital because of something going on in their body, but they're craving what caused the purpose of them being in the hospital. And
Mhm.
then when the doctor put them on that specific diet while in the hospital, they hate it. They start calling family, friends. Can you bring me some greens up here? Just sneak it in. I mean, can you bring me my seasoning? My point is, we are now conditioned, and it's become habit, and we don't realize it. The things we like is actually slowly killing us. Okay, and the only way we begin to think to restructure all of this and see it as important, you have to put God in your life and put Him first. Because let me be abundantly clear about something. All this motivation through psychology, through intellect, friends, family, it won't work. The only thing that I know works to help you understand things, no matter what you think about it, is getting a relationship with God, because He's the one that's going to help you see things that you need to do that you might not see immediate results from. Then
Mhm.
you create a different habit and lifestyle to say, hey, I might not see the results today, but this is going to put me on a new path to live in a different lifestyle. Now, let's go back to intervention versus prevention.
Mhm.
When we talk about helping our community, most of it is more intervention. The difference of prevention and intervention, one, to prevent something is when you go in early on, so you never have to deal with a situation. You start doing
Mhm.
all the necessary work that's associated, so you never have to go down that path on what those behaviors is going to cause. Intervention is once you're already in, you're already doing these things, and then you're getting the negative results from what you do. Now you have to intervene. And this is where it becomes very problematic for when we're stuck psychologically. A lot of what we're going through is not physical. The results and the symptoms of what we got come out in the physical, but it's all stemming from the psychological. Everything is in the head.
Mhm.
That's why the Bible said, Paul said, we have to learn to be changed by the renewing of our mind. Okay. And let
Mhm.
me be clear. That's the one thing we don't want to do. Now, we want to be fixed. We want to be helped. Don't get me wrong. We want the weight
Mhm.
off. They say, oh, I want to be happy, Pastor. I want to feel joy. No problem. But then when you talk
Mhm.
about regimen, that's when you lose people. And what we don't get, there's no
Mhm.
magic potion. You have to put in the work for whatever it is to help what you are going through, or your chronic
Mhm.
disease, or your mental health. You have to put in the work. There's no shortcuts. But let me
Mhm.
get to some of what causes our looking at things the way we do. Life. And what
Mhm.
happens is, sadly enough, I've learned we put more things and people first before we put ourselves. Case in point, the average mother raising a family, she's putting her family before her husband before
Mhm.
her children
Mhm.
before
Mhm.
her. And if she grew up in a family where she had to become like a mother figure too early, she's putting all of her sisters before her,
Mhm.
all of
Mhm.
their children. I'm just telling you. And what
Yes.
happens is over time, the neglect we do to ourselves, we
and
then
and and and, and if
uh,
I could say what right there could for you, uh, right there in this same person you're speaking about prototype
mhm,
then begins to perceive themselves in a different manner and deferring their own self-care, deferring themselves,
yeah,
and then it affects themselves, affects the choices, it
correct.
seems, that they then, would you say, in their what they select in their food, which is a part of their own, what, culture building.
Yes, ma'am.
Right.
That's exactly right. And don't
Mhm.
get me wrong, what
Mhm.
we're pointing out, we that's participating in this, we mean well. And believe it or not, I got to say this, a lot of people that's putting everybody before them, they're knowing that they're helping and they're sacrificing. So they're thinking in their prayers, excuse me, God is going to take care and make sure that I don't get sick while putting others before me, that I don't have a stroke while putting others before me. God, through my prayers and my diligence in serving Him and sacrificing, I won't end up in the hospital. But what we don't realize, the Lord don't work like that. First of all, He gave you five senses. Second of all, the only person you should be working for like that is not man. It's not your husband. It's not your wife. It's not your children. The only person you should give that kind of effort to and energy to, where you neglect yourself, that's for God. So we didn't mixed all this stuff up. Then we're expecting God to magically make sure we don't end up with a stroke.
Yes.
If we continue, and we're talking about this, so we got
Now,
to.
while you say that, I want to share it right there, right where you are, that when the person sees that, what it is that with the blood pressure or seeing themselves in that situation, it seems that they are going ahead of themselves in time. For example, a stroke, going ahead of themselves that build the stress faster than their body is going. And that when they do pray, it brings them back to slowing them down from going ahead, and brings them even where they could actually begin to see themselves. I
Correct.
just wanted you, I didn't want that to go slip right on by, so
No,
so somebody could see that or hear that.
no, ma'am. You're right. You nailed it. That's very, very vital, even in our prayers. That's what you're pointing out.
Hmm.
Again, we mean well. And when we pray and we bring all these things to God, I think we forget that there are things He gave us the ability to do. Now we need Him, and He wants us to need Him. He don't want us to do anything without Him. Don't get me wrong. However, if it's time to go take out the trash, and the trash man come at 8 o'clock in the morning, and you get up at 8:30, you pray all you want. You miss the trash man. I'm just saying.
That's good. That's good.
But we've been taught that all I got to do is pray, and I get up at 8:45.
Yes.
The Lord will hold the trash man up for me. I hear you, brother or sister. I got it, but it don't work that way. And we got to get out of this, because a lot of this stuff we have enacted through our culture has created our mental health, and even how we look at God, how we think He works. And then we got people that's confused looking at us that say we know God, following Him the wrong way because we are ignorantly following God. We really don't know what we think we know. And then other people that don't know God, they're looking at us following God, and we are misconceiving a lot of things and then teaching that misconception to other people that don't know what we know. So you got this bad pattern, and nobody wants to talk about it, because now we're talking about pride. Then you're talking about, well, I'm already down. I
Hmm.
don't really have time for this. Then when you want to talk about the truth of it, they take it so personal. See, that's the second thing about it.
Yes.
Because see, we need so much encouragement that when we hear the truth, we don't think it's encouragement. That's
Hmm.
how bad off we are.
Hmm. Hmm.
And then the person that's going to tell you the truth, you don't want to hear them. You want to hear someone that's just giving you what you think
What you want to
is
hear.
exactly. But the truth is what's going to help you. And the truth initially, it's going to hurt you, because it's going to tell you, hey, you're not doing this right. What? I've been doing this 37 years. You're not doing it right. Now, if
Hmm.
you want these results, okay, you're going to have to hear you're not doing it right, and then
Yes.
be willing to change. Right there. When somebody come and tell you that to you, they telling you, well, they putting me down. They don't care. Oh, here it is.
Hmm.
They don't understand. Then they go with these long, drawn out discussions, what they need to get out. That's what therapy needs to come in. They need to get that out. So I'm
I
just,
have a young lady Speaking about what you're talking about, I have a young lady that I'm really concerned about. I've just gotten her. And speaking what you're saying, she's going through the same habits. She has health issues. Um, and so you're reading and talking with her about some things. She can't hear it. She doesn't want to hear it. And she's not allowing herself to create options. She doesn't want to look at it. It becomes so hurtful to even hear, let's talk about it. Just to talk about it means that she's defensive. She's got to protect herself, which goes back to some things in the past. But as I was sharing, when we were talking, I said, what little itsy bitsy thing could you let in? I don't want to let anything in. I don't want to do, that. So right away, what they're calling stuck. So I'm going to have to go in and see right now, what is it that you really believe that would help you?
Correct.
See, so now it has to come from a different letter, what you're speaking of right then. But now, because she's relying on what? Old habits to
Correct.
bring her out. And the old habits are not going to bring her out. Old way of thinking is not going to help her. So we're going to have to use that to kind of get through. Mm-hmm.
Correct. And there's a term I want us to hear today. It's called cognitive emotive dissonance.
Yes.
What is that? That's just a big psychological term for this. Whenever you are a human being set out to make a change, right? Meaning to do something different, to start practicing something different. Your initial steps, your initial hours, your initial days, weeks, and months, right, are going to be very, very uncomfortable. Why? This is new. You're not going to be comfortable. You're comfortable in the old way you do things. You're comfortable in the old way you think about things. So to change a pattern, you have to be willing initially to be uncomfortable,
To take a chance.
to take a risk. That's what they call psychologically cognitive emotive dissonance, meaning you're not going to like the way you feel in this new thing, but that's natural. It's new. When you go to class for the first time, when you left high school, went to college, you didn't know nobody on the campus. You didn't know what an office was. You didn't know what to do, but you didn't let the uncomfortable aspect of not knowing anything about the campus, prevent you from going. And what happened? You went, and then one thing led to the next. You enrolled, you're in classes. And then the next year, year two, third semester, you are now comfortable in a new place that first created a lot of uncomfort, discomfort, a lot of being nervous and scared of the unknown.
Mm-hmm.
We tend to lean towards what's comfortable, and that is counterproductive and counterintuitive. But
You're
we
right
don't
on target.
realize that.
Mm-hmm.
So, my point, when you're telling somebody what they need to change, they'll hear it to some degree and then they might try it. But what's going to happen? They're going to hit the initial stage of being uncomfortable. And pretty much, I would say 90% start leaning back to the old ways.
So, I have this intervention. I say the word and I let them create the intervention. I said, okay, what you're speaking about and what Miss Tierra talked about earlier in terms of quietly changing their food or habits, I call it oozing. So I said, let's give it a word of oozing. What could we ooze today? That means that if you just squeeze out just a little bit of something new, what could we do? And I find that when we can get one little ooze that's so low threatening, less threatening, that generally we can kind of begin to move forward. Every day we give a number to the ooze, you see, until we get there. And then, but I was saying that what you were talking about in a mental health way, people tend to avoid the big chunks because even if they begin to see it as a big chunk of something that they have to change and it's fearful.
Correct. And everything to them becomes impossible.
Impossible.
Okay.
That's
That's
right.
the way they see what you're saying. No
Mm-hmm.
matter how good, and you can explain it theoretically all you want. They'll say, yeah. But for them
Mm-hmm.
to actually start it and be consistent and become disciplined,
Mm-hmm.
it's for them it's gonna be impossible. Now let's add to what's causing this too. Life, what they've been through. Okay, don't add who we are in this world in America. You got all these other layers of challenges, right? That don't go anywhere. You're trying to change in the
Mm-hmm.
layers that's causing you, for the most part, to be where you are, won't go away. So you got to begin to do something new while these other factors
Mm-hmm.
continue to persist.
Oh, you need to repeat that. You need that's the key. That is the core right there. You need to just get that back in there.
Because one thing I've learned in my own life personally, when I came to God, Jesus Christ, let me be clear. But anyway, when I came to the Lord, it's something I realized. It was the greatest thing a human being can ever do is come to Christ and give their life to him because he gave his life for us. So really, your life don't belong to you anymore, which is a different discussion. But when I started down that journey, I really thought euphorically, but I didn't know I was thinking euphorically. I thought that while I was getting my life together with the Lord, these other things that was challenges was gonna go away. And then I was going I was gonna have the freedom, y'all, and the luxury of just focusing on changing my life, listening to the Lord. I ain't gotta worry about my cousin calling me with their mess for 6 months.
I bet
Because
you
these
got
six
more
months,
stuff. I bet you got more stuff.
I got way more stuff.
Wait,
I'm
more
still
stuff.
being treated as a black man in America while getting my life together. None of this stopped. Nothing stopped. If my knee hurt it hurt it still. I had to take care of my knee while focusing on Christ. But nobody's teaching us this. And we don't know what to
Right.
do when we hit these
Yes.
pockets.
Yes.
Then we start thinking, has God left me? What's wrong? In the 23rd Psalm, it
And then
starts
you'll
right
have somebody standing next to you saying that you must have sinned.
exactly. I'm just saying. Then you got these people that's feeding me this stuff that they think is encouragement, but it's just a pill. Okay. And I got to tell you, it has the equivalent, I got to say, of going to get high or have a drink with these little encouraging pockets of things that we get from the community and society and successful people that has made it in the world outwardly, but inwardly they're lacking for the soul and what's necessary for the soul. The soul don't need no pill. That ain't gonna last. And that's what we're lacking. That's why we refuse to come to God to get what we need for our soul. We would rather go listen to a let's get rich quick scheme. Let's everybody just feel better. Let's think positively. Look, y'all, it don't work. If you don't get your soul together with Christ, I don't care what you add on top. It's like a foundation. You don't build no house on something that don't have a foundation. And what happens, we go around God and we want to hear from the people that has been successful worldly, secularly, carnally, and then we think it's going to equate and substitute positive, positive, success, success. Look, y'all, when we talk about God, God is a spirit. That don't even talk. That's like oil and water. But nobody's telling us this stuff.
Mm-hmm.
And we're trying to feed our soul with something carnal. It ain't gonna last but for 3 minutes.
Mm-hmm.
So anyway, bottom line, A, we have to be willing to change. B,
Mm-hmm.
we have to be willing to be uncomfortable with the unknown. There's no way you can discuss change without going through the unknown.
Unknown.
It
Mm-hmm.
goes with the territory. But that's where faith comes in.
Mm-hmm.
Hebrews 11 and 1.
Mm-hmm.
Faith is the substance of things hoped. Let's stop. Hope. What is hope?
Mm-hmm.
Is hope tangible?
No.
Can you see hope? Can you hug hope?
Mm-mm.
Can you kick it? You can't even put it on. You can't smell it. Huh? So think about what God is saying.
But
Hope.
I know this.
Come
You
on.
know it when you got it.
Amen, sister. Amen. So the Bible says faith is the substance of things hoped. That means this is not reality yet. This is what you're hoping, wishing, imagining,
Mhm.
but the evidence of things not seen. We've been thinking we have faith and we ain't got no hope, and we need to see something to do something or to continue to move forward. That is not faith. And then the Bible said, faith without works is dead. And then it
Mhm.
says, without faith, it's impossible to
Mhm.
please God. You have to have faith, y'all, because when you start out to do something new and different, all you're going to have is your hope. There's
Mhm.
not going to be anything tangible because you're going into a new arena, entering into a new zone. Let me say this quickly. As I drive sometime in life, literally driving, I'm with my family, and my wife might be, oh, honey, do you know what we're doing? Do you need me to pull it up on the navigation? I'm like, nah. Now she's thinking men don't like to be told nothing. Different discussion, different day.
Well, now that's a whole different topic.
Yeah, I
We'll,
know.
we'll, we'll get on that one
We
day.
can talk about that another day. I'm fine. I'm fine with being non-biased about it. It's cool. So anyway, I'm like, no, I'm fine. But what I'm trying to teach her and people, sometimes you need to go get lost. Mhm. You see, we sometimes don't allow ourselves to go through something different. As soon as something feels different, we start thinking we
Mhm.
need to call somebody, pull up the phone, use mechanisms and devices. What if you need to get lost that day? You look lost, but when you go through it, you just learned a new way. But it felt like I was lost and you started to panic. Keep going. Even if you got to turn back, you
Mhm.
just learned a new way. But
Mhm.
see, what I'm saying is we don't realize we stunt our own growth because we start feeling uncomfortable. And then we go to these devices that the devil has given us
Mhm.
that feeds you, not growing. Then we say,
Mhm.
Lord, help me grow. And
Mhm.
you don't even want to get lost. How are you going to grow if you ain't willing to be lost?
They tell you to leave early enough from home so you can get lost. So
My, at my point, all this factors into our culture, our mental health, and then we start dealing with these chronic diseases because so many things that we do for others that we don't do for ourselves start being suppressed. And as Sister Tiara said, if you lose sleep for 35 years, huh? Think about that, y'all. This I'm not saying a week, a month, because you're in college and you got 5 different things to do. Get it. 35 years of 3 hours of sleep. 35 years of bad food on top of bad food. 35 years of negative things from the environment of your family and I have to say your church or your friends that you've been in. That's 3 major things. That's a recipe for disaster. 35 years. And then when you finally go to the doctor start telling you about change. You want it,
Mhm.
but you're demotivated. And the more he tell you you need to work on and change, the more you hearing it's impossible. I want to do it, but it's impossible because you have never put yourself first.
Mhm.
Then you're battling with, is it okay? Some people think it's not godly to put yourself first. I'm
Mhm.
just telling you, we just got a lot of things, y'all,
And
backwards.
so also what I right there where you are is that what you're saying is what we believe and what we're thinking. So what I find is that when the person is right there where you are, they're at the doctor, and they're getting more information and they're feeling overwhelmed. That actually they came there with the mindset to be overwhelmed. Now let me say how it is, because they have not looked at what you spoke about the options before or what they could do, or whether they looked at the hope, a possibility of any new anything. So is it then the mindset that the person had that everything that's coming to them will be pressure? So I hear people say, "Oh, that's going to be too hard. That's going to be too much." And I say, "Well, how do you know? You haven't tried it." So is it that culture, our experiences are having us to move towards something because of habit or whatever, to limit our potential or to limit the options before we get there? And that's where the anxiety and depression, 50% or 80% of it's coming from.
Yes, ma'am. Failure, stress, discomfort, being mistreated, all that over a certain period of time will cause us all to think negatively. But we don't see the other problem with this. We don't realize that the way we think is negative, which
Yeah.
is a deeper problem.
Mm-hmm.
So think about it. If somebody don't think they're sick and they came to you for some flour, Dr. Lewis, you got some flour? As you coming in from the kitchen getting the flour, you notice the twitching of their eye. And they came to you for flour. You say, here's the flour, but what is that twitch? They say, what twitch? I hear that. What trick? What twitch? Now you're going to say, well, wait a minute. Have you gotten that looked at? No. I don't even know I have it.
Mm-hmm.
Life don't allow me to pay attention to me. And when I do,
Mm-hmm.
I look for shortcuts and don't know it. And then if somebody point out something about me that I'm not looking for, I'm not open to hearing that.
Right. Who do you think you are? You think you know everything? You
Or
don't.
here's another one.
You don't know
That's
me.
it. They get defensive. And then if you're a white person,
Mm-hmm. Yes.
and you the black person, you're
Yes.
like, well, see, you don't understand. You don't know what I've been through.
Yes.
You would understand why I might have a twitch. I still don't think I got one, but if you would understand what I've went through, right, you wouldn't be judging me. Here we go.
Right. Yes.
But that's all because of the conditions in our life. We
So
don't
I
realize.
even I told that because I even had people to have sores on their legs, and I said, "Do you think we might have to have Dr. Atkins or somebody look at that, because that could be?" And then they have diabetes. And I said, "Have you had?" And you know what they would do? They'll pull the pants leg down
That's right.
over it and try to make it go away or something.
Correct. And don't get me wrong. I don't want people
This
that's
is
going
for
to
real
hear
that
me.
I'm speaking about. Miss Tira shaking her head. I'm
Yeah.
saying, Miss Tira, this is a real situation.
Yeah.
That because if I go to the doctor, they're going to give me something, and they're telling what happened to me, because I may die if I go to the doctor or get sick. So I don't know what to do with this.
Right.
So I'll just let it heal itself.
Yes, ma'am. And we just sadly enough, because of what we went through, to level with everyone. Don't get me wrong. We look for comfort, y'all.
Mm-hmm.
We look for comfort in food, friends, environments. We just look for comfort. And sad enough, we haven't been taught enough about the human body and the human element of sin.
Mm-hmm.
That's another discussion. You
Right.
might mean well in your comfort that you're seeking, and you are suffering and going through, no question. But when you seek comfort in the wrong places, in the wrong people, in the wrong environments, from the wrong foods, what do you think you're going to really get? You may have sought comfort, but what you got in return is inducing what your situation was prior to going to that thing or that person seeking help. You're now about to compound your initial problem, but you don't even see it. Because the people you seek comfort from, they sick too.
Mm-hmm.
It's really bad in this reality. And let me be clear about this. I can sit here in retrospect, right? And I don't want no one listening to this to think, well, he don't understand. No, I understand. Everything I talk about is what I go through, went through, and what God is helping me to be delivered from. So I'm not just talking theory. I'm talking practice and theory. And that's what we don't get much of. So I'm not just
Right.
telling you what I read, what I've watched or
Right.
studied.
Mm-hmm.
No, I got that. But I'm also sitting here as a person that have went through everything you're going through now, but also went through a process because I had to fight to
Yes.
accept the help. I had to fight over my own feeling uncomfortable because when God used somebody to bring me hope and I wasn't even able to see hope, God brought hope to me. But because I'm so down and so depressed and so sad and suffering through so many things, when God sent hope, I thought it was hate. That's how it registered to me. But I didn't
Right.
understand that.
Mm-hmm.
So I know what I'm talking about, not just from theory, but from
Right.
practice. This is
Right.
what's happening. It's alarming.
Yes.
It's scared. It's scary. It's sad. But
Yes.
there is true help and
Right.
there is true hope. But
That's
you
right.
and I, the individual, got to be willing to be uncomfortable,
Mm-hmm.
to work. And
Mm-hmm.
I don't mean go and get a job work. I'm not talking employment. I'm talking work to make a difference in how you think, how you
Mm-hmm.
feel, to help
Mm-hmm.
yourself from these diseases. And again, these are long-term effects. And don't think when you start doing
Mm-hmm.
things to remove it. If it took 35 years for you to get heart trouble, don't think because you start working out 3 months, right? Your heart failure is just going to go away. And then start to get depressed because it's not moving. It took you
Yes.
35 years of
Yes.
bad decision making to
Mm-hmm.
get to where you are. So be hopeful and let God help you start doing the necessary work incrementally. It's going to come over time.
And it's within you. When you're opening up, the God is within you. It will come. It's going to grow in you
Yes,
to
ma'am.
have the hope. Practically, I'm trying to give a visual scenario, and that as you're speaking, so that our audience, as I'm getting it, so that our audience would hear, and that then changes what you're saying. Some of the cultural factors, we have a lot of strong, we all have a lot of strong stuff, but how to get rid of the negative, recognize, get rid of the negative, hold on to the strong, and then change the way you're thinking about what you can't do and you can do, and begin to get rid of you can do and look at what I can do and what possibilities do exist. As soon as you get rid of can't, and then begin to see what direction am I being led. See that now that I'm getting connected, please let me know what it is that I need to do more of for this hope to get healthier and better. You see, and moving in that way. So you're rethinking,
Yes, ma'am.
reterming, rethinking for moving toward mental health and balancing yourself. So then, whatever chronic disease we have, whatever is going on, prevent or whatever, we would have a different approach as to how we're going to prevent or how we're going to manage it.
Yes, ma'am.
I'm trying to make sense here.
You
I'm
own it.
trying
You
to put
trying
the
it. You
actions.
trying it.
I'm
You
trying
trying
putting
it.
the actions together here,
Yes, ma'am.
and
And
so
I'm
we
gonna,
would then not have Miss Tiara. We would then have very little. We would have it only from what? From storms or something that's beyond a power beyond. It might be something in the air, or it might be something like that that might affect us. But otherwise, we would then be on the road to which we was given to us if we didn't
exactly.
destroy it, through our fear and avoidance.
Exactly. The 23rd Psalm says, "The Lord is my shepherd, I shall not want. He maketh me to lie down in green pastures. He leadeth me beside still waters. He restoreth my soul. He leadeth me in the paths of righteousness for his name's sake." Here come the fear when he's leading you here.
Our
Yea.
time, they just let me know our time is up.
All right then.
I do want to tell everybody to go to wrc-houston.com, wrc-houston.com. Please sign up for the relationship seminar. You don't have to be in a relationship, just what we talked about. You're preventing any difficulties. If you are in a relationship, it will give you experience and helpful hints And you can even turn your camera off and listen if you're a little shy about that. So go to wrc-houston.com. Thank you, and I look forward to seeing you all, same place, same station, on next week. Rebuild, renew, and reconnect. For it is not the circumstances we meet, it is the manner in which we respond that determines health, happiness, and success. And I'll see you next week.